How would you feel about someone doing surgery on your brain to change your personality? Hi, my name is Emma Bernstein. I'm a second year medical student at the Perelman School of Medicine at the University of Pennsylvania. I am presenting my Neurosurgery 200 capstone project on the history of functional disorders in neurointervention. In this talk, I will go through a timeline of the history of psychosurgery. So we're starting with very early psychosurgeries and functional neurosurgeries and going all the way up through 1974. And I'll touch on most of the points outlined in this timeline. The earliest neurosurgeries are actually seen in the act of trepanation, which is what's called when you sort of made a hole in the skull, the early version of the modern day craniotomy. These skulls have been dated all the way back to the Neolithic period, estimated around 5,100 BC, but reports have even claimed that they've been found at 8,000 BC. And they've been found in many prehistoric cultures all over the world. The first trepanated skull was found by a French anthropologist in 1783, Dr. Berniers, and Paul Broca, who is an important neurologist who we'll discuss later in this talk, also found interest in these skulls. 50% of the trepan skulls have shown evidence of healing, which shows that the procedures did not result in death. This is important because it means that these were not accidental injuries, but instead deliberately done actions. Dr. Berniers also realized that these were deliberately done actions by looking at the pattern of injury around the edges of the skull. The bone was also often replaced with other substances like gold or other metals, which suggests mystic or symbolic interpretations to these operations, and is feasible and likely that these trepanations were done for modifying not just health but also personality. So, how did ancient humans come to trepanation? The concept, the theory behind this is looking at the idea that the brain is an organ that we have learned has something to do with death through accidental traumas. It's the concept of someone losing consciousness or sort of appearing to be dead upon a brain injury and then regaining that consciousness was provoking of curiosity among early peoples. And there's thoughts that this acts of trepanation was an attempt to exploit this relationship. You can see on the left in this image some of the earliest surgical knives that were used for trepanation by spinning very rapidly on the skull in order to create force and sort of slowly create a hole. Trepanation did not just exist in prehistoric times. It continued into when we document history. One of the first and most notable practitioners of trepanation was Hippocrates, who in 5th century BC described it as a way of treating head wounds in his book on head wounds. His knowledge of neurosurgery and neuroanatomy was actually somewhat accurate to how we would think of things today, and he described what were clearly subdural and epidural hematomas. The popular trepanation sort of waxed and waned throughout cultures and time, but could be seen as a treatment for madness in the 1400s. And you can see here in a Dutch painting the extraction of the stone of folly, the extraction of the stone of madness, a neurosurgeon performing trepanation to try and access a stone of madness in a man's head. And you can see on the right of this painting that the nurse has a book on her head reflecting that she's the more learned one in this situation. These were all the precursors to what has really allowed for a functional neurosurgery today, which is the idea of localizing piece behaviors and parts of the brain. The groundbreaker for this field is Dr. Franz Joseph Gall, who established the field of phrenology. He published a landmark book in 1810 describing the way the brain correlated with behavior in both men and animals. the description of it is: the brain constitutes a system of distinguishable organs, every one of which, as a material instrument, coexists and cooperates with a determinate one of the mind's aggregate faculties, and that consequently, from structural or functional lesion of the cerebral organs, the manifestations of mental faculties may be deranged. And you can see here an idea of what they thought each part of the brain corresponded with. The field of phrenology was also used to perpetuate racist ideas about intelligence, and it has been largely misaligned as a concept, but still was the groundwork for a lot of our understandings of how the brain has different anatomy. The relationship between brain and behavior, perhaps the most famous example of which is the description of Phineas Gage. Phineas Gage was an iron worker in Vermont who survived a rod going through his skull in 1848, and Dr. John Harlow did work with Gage after it was seen that after the rod went through his skull, there were large personality changes. He was considered a very gentle, easygoing person prior to this incident, and then afterwards became very challenging and disorderly and committed acts of vandalism. His friends described it as Gage was no longer Gage, which really showed that there was something in the brain that impacted who someone was and how they behaved. The localization of the brain continued with the work of Dr. Jean-Baptiste Bouillard. He was a very famous doctor who also was known for his work on rheumatic endocarditis. He went on to train Dr. Paul Broca, who described Broca's area, and Dr. Paul Broca went on to train Carl Wernicke, who described Wernicke's area. On the right here, you can see an image of an old image of Broca's area and the concept of aphasia de Broca, which is the aphasia that is associated with Broca's area. And these are some of the more, and these are terms and localizations of the brain that we still learn and are important today. The first psychosurgeries were performed by Dr. Johann Gottlieb Burckhardt Husserl, who performed 6 surgeries between 1888 and 1890. He called these surgeries topectomies. You can see one demonstrated on the upper right, which they were targeted removal of the cerebral cortex in patients with schizophrenia and auditory and visual hallucinations. 2 of the 6 patients did not survive the procedure, but the remaining 4 were rendered compliant, which is considered a cure, but may have been just a real blunting of their affects. You can see on the bottom right the actual tools that he used to perform these procedures. At a conference in Berlin in 1890, his surgeries were met with widespread criticism and revulsion, which ended his exploration of psychosurgery. Dr. Lodovic Pucept also attempted psychosurgery in 1910 by sectioning the cortex between the frontal and parietal lobes in 3 patients with major depressive order. The outcome of this also was a blunted affect, and his first attempt was not widely published or spread. After this, however, this began the golden age of psychosurgery in 1935. The context for this is important to understand, which is that 450,000 asylum patients were within the U.S. alone in 1937, and a modern-day equivalent of $24 billion was spent on asylum maintenance. So there was concept of mental health and insanity was a huge issue in the world and something that people were very conscious of and were hoping to find a real cure towards. The first lobotomy ever performed was by Egas Moniz and Almeida Lima in 1935, and they injected alcohol into the white matter of the frontal lobe of a 63-year-old woman with paranoid delusions, anxiety, and melancholia. This surgery was widely considered to be a success despite her subsequent blunted affect. Notably, Lima Moniz won the Nobel Prize for the frontal lobotomy in 1949. And you can see on the right an actually later method of performing the lobotomy, with an instrument that they use instead of the alcohol. The frontal lobotomy in the U.S. was pioneered by Penn Medical School trained neurology Dr. Walter Freeman, working with his partner who was a neurosurgeon, James J. Watts. They performed their first frontal lobotomy in the U.S. in 1936 and went on to perform 200 in rapid succession. Dr. Freeman was a large promoter of the procedures, and he also invented what's called the transorbital lobotomy. This was a controversial procedure as it allowed his mechanism of performing it involved having the patient undergo electroconvulsion therapy beforehand, so they were knocked unconscious, and then using equivalent of like an ice pick to go through the orbit to perform the lobotomy. This meant that it could be performed without an anesthetist or another neurosurgeon. His original partner, Dr. Watts, was horrified by this choice and stopped working with Dr. Freeman after his advent of the transorbital lobotomy. Between 1936 and 1956, 60,000 procedures, 60,000 lobotomies were performed, and Freeman alone performed 4,000 procedures. The end of the frontal lobotomy really declined with the advent of chlorpromazine, which was approved in 1954 and prescribed to 2 million people in that year alone. On the right, we can see an advertisement for it, which is under the brand name Thorazine. When the patient lashes out against them, quickly put an end to the violent outburst. So this was also seen as a real way to contain and quell schizophrenia and delusions. In 1974, the Belmont Report was started to investigate the idea of psychosurgery, and with the ultimate concept that would most likely recommend an end to this procedure. However, when looked through it as scientific message, they found that there was still some benefits to psychosurgery being performed. However, it was part of a sharp decline in this practice. Part of this sharp decline also corresponds with the cultural perceptions around functional neurosurgery and the frontal lobotomy. One Flew Over the Cuckoo's Nest is a very famous 1962 novel. This is an image from the 1970s movie with Jack Nicholson, who at this time is in the movie is undergoing electroconvulsion therapy. This portrays the asylum and the therapies that we've done upon patients in these settings as to be barbaric and done entirely to quell them. On the right, you see the film Suddenly Last Summer, which was a 1959 film written by Tennessee Williams. Tennessee Williams' sister had undergone a lobotomy and was rendered completely was lost all abilities after it. So this is a film about an evil sort of stepmother figure trying to lobotomize her daughter, and it's a clear critique of the procedure. Tennessee Williams was also a outspoken critic of the lobotomy because of its propensity to be performed on people for homosexuality as opposed to any real form of mental illness. In the center is one of the most famous figures who underwent a lobotomy, Rosemary Kennedy, the sister of JFK. She was lobotomized at the age of 23 for having some disruptive behaviors. And her father was concerned that her behaviors would lead to potential embarrassment for the family, worried that she would become sexually active, and so had her lobotomized without her or her mother's consent. The lobotomy was actually performed by Dr. Paul Freeman, the person who performed the first lobotomy in the U.S. Her lobotomy meant that she had to be institutionalized for the rest of her life. She lost all functionality after the procedure. Her father never visited her again, and she was hidden from the Kennedy family tree for many years. Following here are my citations for this talk. Thank you so much, and please reach out if there are any questions.